Now moving to talk about the thoracic vertebrae. The typical thoracic vertebrae, or each thoracic vertebra, is composed of a ventral body and a dorsal neural arch. Okay, three processes diverge from the neural arch. These are in the midline, the spinous process dorsally, and posterolaterally on other sides are the transverse processes. The part of the neural arch that lies between the transverse process and the spinous process is known as the lamina. Okay, this is the lamina, and that part that lies between the transverse process and the body of the vertebra is known as the pedicle of the vertebra. So this is the pedicle of the vertebra. At the junction of the pedicle and the lamina, that is to say at the root of the transverse process, are superior articular processes and inferior processes. Okay, the superior, these are the superior, and these are the inferior articular processes. Okay. The body is heart-shaped. Together with the neural arch, encloses the spinal foramen or the vertebral foramen. The series of this vertebral foramina or the spinal foramina of the whole vertebral column produces the spinal canal or the vertebral canal that lodges the spinal cord. The body is heart-shaped in outline, both superiorly and inferiorly, and it's concave from above downwards, as well as posteriorly it is concave from side to side. Okay, the side of the body of a typical thoracic vertebra shows a pair of demi-facets. Demi means half, and facet is a smooth surface area that is covered with hyaline cartilage and provides articulation. This is the superior demi-facet, is located on the top of the side of the body, close to the superior margin, while the inferior one is much smaller, and it faces downwards. The superior demi-facet provide articulation for the inferior facet located at the head of the rib, while the inferior one provides articulation for the superior demi-facet on the head of the corresponding rib. Okay. Now moving to talk about the neural arch. On the transverse process, on the anterior surface towards the tip, there is another concavity. This is known as the costal facet. This costal facet is covered in live also with hyaline cartilage and provides articulation for the medial facet of the tubercle of the corresponding rib. The superior processes shows a superior articular facets. Those facets face backwards towards the spinous processes and somewhat laterally. Those of both sides lie in the arc of a circle, so they provide some sort of rotational movement that is in the thoracic vertebrae that is limited by the articulating fact of the ribs. While the inferior articular facets, as you can see here, face forward towards the body, so they face forwards and somewhat medially, both lying in the arc of a circle here, allowing for the rotational movement between the vertebrae, successive vertebrae.